everyone, I'm here to talk a little bit about family planning. Welcome to the YouTube guest guest YouTuber. So I'm going to hopefully help just simplify where to find the fields that are very important to record during a family planning encounter, which is also what we would consider a Title X encounter under our grant. So the nice thing is this is simplified based on what Dr. Gorman has been helping us to help connect some triggers. So at this point, if you are doing a visit and you know that kind of family planning conversation has happened or will happen, you can now at this point easily click the family planning encounter button here, and it's going to open up the SOGI template directly for you. Why this is helpful is this is where the fields that need to be filled out during your visit or towards the end of your visit, where we collect that data for our Title X reporting. So birth control at beginning of visit is one of the most important fields. If there is no birth control at the beginning, please then fill out the reason for no birth control, and there's a drop-down menu option here, and then other is acceptable, but blank is not acceptable. Then the next fields that are very important is the birth control at the end of the visit. If you can populate that, what will be wonderful is it will then also populate into your charting field reproductive life planning. It will track it, and it will also populate down into above the assessment and plan. So we say we have had a conversation and this patient now wants to switch to Depo. So starting using condoms, obviously that is a method. We're going to use Depo towards the end, and reason for no birth control at end of visit doesn't need to be filled out because there's a method. But again, if someone had chosen none, this would need to be filled out for our reporting. Contraceptive provision method is just letting the Title X grant know how we are going about getting our patients their Title X medications and prescriptions. Did you write a prescription and send it, or was it provided on site? Okay, and then you always just want to remember to click OK instead of cancel. And then as you can see, that is saving data for us. And if you go down to above assessment and plan, now the fields for the Title X reporting are populated by what you've done in the SOGI. This field here, I never check it because I do consider a lot of Title X visits confidential. This field here would put the data into your master IM, so just be careful to make sure that you are avoiding that if you are doing this in a confidential manner. So if we can really start clicking the family planning encounter box at the beginning of the visit when you know it's going to be included in any sort of office visit. Someone can be there to review lab results and you start talking about their birth control, or do they want to discuss it? This will link us right to SOGI, where the data for our reporting lives and should live, and will make our reports a lot more successful in the family planning. All right, thanks guys for all the hard work you do, and keep doing Title X visits.